Gone are the days when plastic surgery was a taboo subject. In today's world, lunch hour can often mean a tuna wrap with a side of Botox. Our next guest is well aware of that trend, and he's set up shop to help meet it. Dr. Ali Adibfar is the official cosmetic plastic surgeon for Miss Universe Canada. Thanks for joining us.
Thank you for having me.
I want to talk to you about some of the trends, but why don't we start with the pageant itself, Miss Universe Canada. Why did they need an official cosmetic surgeon?
Well, these pageants are all beautiful ladies who have special goals and plans and careers that they want to follow, and basically the whole Miss Universe pageant is becoming quite competitive, and they do need cosmetic dentists, plastic surgeons as consultants to help them project them off of that platform, so they could be very competitive in that arena.
Now, usually one thinks of plastic surgery as something that helps extend youth of a woman of a certain age, maybe in their late 30s into their 40s. These are women in their sometimes teenage years and early 20s that are getting procedures. That's unusual, isn't it? Well,
it is unusual, but I've got to be honest with you. The latest statistics released by the American Society of Aesthetic Plastic Surgery for 2005 revealed that 25% of the procedures being performed were between the ages of 19 and 35. 50% of those procedures are between the age of 35 and 50, and only 25% of those are above the age of 50, from 50 to 65. So there is definitely a trend, a change to a more a younger age, but I must also add that a lot of those procedures being performed on those younger patients are non-invasive procedures.
Things like teeth whitening or Botox or something that wears
fillers
off.
Such as Restylane laser, intense pulse light for photorejuvenation and laser hair removal and so forth.
And in terms of the contestants, I know we can't get too specific, but do they also run the full range, including some invasive? I mean, are there breast augmentation, or do they not get that far or that close to a pageant if they need that kind of work?
Actually, that's a great question. The trend is, and more specifically in a lot of the South American countries, it is well accepted for many of these pageants to have breast augmentations, nose reshaping, and perhaps 5 to 10 procedures before they even reach the age of the pageant. In a North American society, we're not as open to that, but I think the trend is definitely towards that, and that's what the Miss Canada, Miss Universe pageant is trying to have a more open-minded approach towards that.
I was reading a research paper from actually a hedge fund that was talking about new companies that are creating technologies that don't require surgery. It's almost like putting putty into your face, injecting fillers basically to help out stretch and make people look younger. Is that a new promising technology?
It's actually not it is a very promising technology, and it's not new. It has been around for many years. However, we have come up with filler materials that are more and more reliable and longer lasting. When a face ages, there are 3 processes that are going on at the same time. One of them is a descent or stretching of the muscles. The other one is the degeneration of the skin, but the most important one that we are focusing on now is the deflation. As you age, you lose a lot of volume in your face, and a lot of these filler agents that you are discussing are used to refill the face essentially and give it that more youthful look again.
You've got a clinic here in Toronto, North Toronto. You're opening up a second one.
That's correct.
Toughest question last, doctor, and that is we live in an age where we see face transplants, where the surgery, your expertise can be applied for very serious reasons. Do you make a distinction between the woman who just has always wanted higher cheekbones and the woman who needs a face transplant because her face has been mauled?
No, there's... to me, in my practice, all patients are treated like my own family members. That is my philosophy. So, but there are specific plastic surgeons that concentrate on that aspect of plastic surgery, which is more specifically the reconstructive aspect.
Yeah.
In my clinic, I concentrate more on the cosmetic aspect of plastic surgery.
All right, we gotta go, but we appreciate you joining us.
Thanks for having me.
Dr. Ali Adibfar is the official cosmetic plastic surgeon for Miss Universe Canada. Stay with us. Kevin's got a play of the day, and we've got some viewer email after this.